To ensure that proper and adequate material is obtained from a biopsy, so for all diagnostic biopsies, most institutions will employ either a cytotech, a cytology fellow, or actually a cytologist, and on-site adequacy assessment is performed. And that's not 100% reliable, but it gives us a good indication from these on-site aspirate assessments, whether the subsequent material, which will be made into a cell block or an actual core and formalin, will have adequate material, and that's really the best that we can do. And then the other thing is we always, as pathologists, and we try to communicate that to our colleagues, we want as much tissue as they're comfortable giving us or acquiring. As a pathologist, to ensure that we have adequate tissue for all these downstream analysis, different protocols have been established to really make sure that with limited amounts of tissue biopsy that we are able to perform all these tests. And some of these strategies, so at the Rutgers Cancer Institute, what we've been typically getting adequate material, but one place where you sometimes lose material, especially from the smaller biopsies, such as the FNA cores, is some of the immunohistochemical stains will face some of the block, and then the histotech would have to go back and face more of the block. So up front, we're actually knowing that we're going to need a lot of this tissue for downstream molecular tests. We've set up protocols where 20 unstained slides will automatically be cut when we know that this is a lung adenocarcinoma that's going to need some type of downstream molecular analysis. Other strategies people have employed is oftentimes we get multiple core biopsies, and one thing that some places do, we're not doing this currently, is actually splitting the cores between different tubes or different blocks, and that way it gives you a little bit more material from the multiple cores that are often obtained. And then with the newer guidelines that have come out from CAP and Association of Molecular Pathology, it's now also recommended, or it's with these newer guidelines, it's okay to perform testing on aspirate smears, whereas with some of the older guidelines, that wasn't a recommendation. So that's another source where you potentially can get material, but with the caveat being that these aspirates, if you're going to perform any of the downstream molecular analysis, they have to be validated the same way you would for blood or other tissue.